Welcome to Marian Ayurveda. In this episode, we are going to discuss the disease known as piles and its various types. It has 4 or 5 stages. We will be discussing how effective Ayurvedic treatment is for this and whether surgery is necessary. I am Dr. Anumod Kakkassery, Marian Ayurveda Thrissur. Most of us have some idea about what piles are. When we say piles, it's similar to a disease we are familiar with, varicose veins in the legs, right? In the legs, the veins become thick and enlarged, forming bulges in a circular manner. In the same way, when such veins are present in the anal region, we call it piles. There are internal piles. Similarly, there are external ones as well, right? We know that there are 2 types of piles, those that are visible and those that are not. In the same way, piles are classified into 3 or 4 stages. First, what we call the first stage is when, even while passing stool, you notice 1 or 2 drops of blood. The pile mass is not visible outside. There is bleeding. If it is fresh blood, if it is bright red blood, then most likely it is due to piles. We call this the first stage of piles. In the second stage, when passing stool, the pile mass also comes out. After passing stool, it automatically goes back inside. After the second stage comes the third stage, where even after passing stool, the pile mass comes out. But it does not go back in on its own. We have to push it back inside with our hand. The fourth stage is when the pile mass does not go back inside, no matter what. The condition where it continues to hang outside is what we call the fourth stage. The first and second stages are very easy for us to manage. We can manage it with various home remedies and such. But when it progresses to the third and fourth stages, it often requires surgery. In this episode, I wish to talk about how we can treat piles that have progressed from the third to the fourth stage using Ayurvedic medicines. Once a lady came to me, after it tears, there will be swelling. These people have piles masses that do not shrink. Upon examining these formations, it is clear that the total volume of their accumulated pile masses does not show any signs of shrinking or reduction. They remain physically stable over time, maintaining their original density and structural integrity despite the surrounding conditions. Their piles masses do not shrink. To help shrink their piles masses, I prescribed a medicine specifically for the pain. I want to clarify that I did not prescribe this medication solely for the purpose of managing your pain levels. It is very important for me to explain this thoroughly to the patient so there is a clear understanding of the treatment plan. Once the initial swelling begins to subside and the inflammation goes down, you should be aware that it is quite common to notice a small amount of blood when you are passing stool. This is often a temporary part of the healing process as the tissues adjust, but I will continue to monitor your progress closely to ensure everything is healing as expected. We will discuss any further symptoms during our follow-up appointment to make sure you feel comfortable and informed about every stage of your recovery and the potential side effects you might encounter along the way. It is essential that we maintain open communication regarding these physical changes so that we can distinguish between normal post-operative symptoms and anything that might require additional medical intervention or a change in your current prescription regimen. Please keep a close eye on the frequency and amount of any bleeding you observe after the swelling has decreased significantly, as this information will be very helpful for our next clinical assessment. Even bleeding, I must fly like a chicken. For him to fly, is it beef? Regardless of whether you are working with a piece of chicken or a cut of beef, if you truly want your culinary creation to soar to new heights and fly, you must deeply immerse yourself in the process and actually learn to think exactly like a chicken would. This means understanding the texture, the flavors, and the very essence of the ingredients you are handling so that every single dish you prepare reaches its absolute maximum potential in terms of taste and presentation for your guests. In many instances where an individual finds themselves struggling with the persistent discomfort of chronic indigestion or perhaps the painful irritation associated with piles, there is a very noticeable physiological trend where their entire body will generally begin to feel quite cold to the touch. This lack of internal warmth often stems from the way the body manages its metabolic processes and blood flow when dealing with these specific types of internal ailments. Consequently, instead of maintaining a steady and vibrant heat, the person might experience a lingering chill that permeates their limbs and core, making it difficult for them to stay warm even in a temperate environment. So in this way, we can generally see that there are 2 very distinct and different types of piles that patients often encounter in their daily lives. Similarly, it is crucial to recognize that there are various kinds of foods that naturally generate a significant amount of internal heat within the human body. For example, after consuming something like eggs, many people will clearly notice that our body begins to feel that specific kind of intense radiating internal heat. Furthermore, certain foods such as tamarind are well known to be quite problematic because they can actually trigger active bleeding for those individuals who are already suffering from the discomfort of piles. At the same time, for those people who are constantly struggling with chronic indigestion, if they choose to eat heavy or rich foods like nuts or a flavorful biryani, it can significantly worsen their overall physical condition and lead to much greater discomfort. In such complex medical cases, there are certain traditional remedies and specific things to try, and within our ancient practice of Ayurveda, we must carefully consider all of these different constitutional and lifestyle aspects. As I mentioned earlier in our detailed discussion, when a patient unfortunately reaches the fourth stage of piles, the situation becomes much more serious and difficult to manage because the pile mass may hang outside the body and simply cannot be pushed back in manually. And because of this constant pain and the physical protrusion, it may not be possible for the individual to perform any kind of physical work or even carry out their normal daily activities with any degree of comfort. At all times, the external pile mass may continue to hang outside the body and remain in that position indefinitely. In such cases, a large number of patients have unfortunately not reported any significant or lasting results from the use of various types of medicine or topical treatments. Anyway, as I have mentioned to you earlier in our discussion, before you decide on going for a surgical procedure, we really need to carefully evaluate all the other available options first.